Can you see us?
Yes.
Good morning, everyone.
Morning.
This is my friend Warris.
Hi.
He's a physician who's soaking wet. Come on, Claudia. And I'm not making him wet. He's exercising, okay? That's what we're doing here.
Hi.
Well, I am a widow, after all.
How's it going?
Some exciting things are coming up for Warris, I think. He's
Yeah.
acting a little shy.
Me?
Yeah.
No.
How's
Because he can't see.
How's it going?
Good.
That was good.
Wasn't bad. You're getting closer.
What?
My English accent.
Her English accent.
Oh my
She
God.
sounds less like Russell Brand, thank God. But,
Emily Blunt's really good at hiding her accent.
yes, she is. She's very good.
I watched, she has a drug salesman, opiate salesman is the movie or something.
Okay, I don't want to talk about dumb stuff.
It's a very educational movie.
I'm gonna get a picture of you guys.
So-
On Twitter. Look at Claudia. She's like freaking third wheeling. She's like,
I
hi.
always am. So I do have a lot of people that are always like, I wish I had an advocate like you. Like, I wish I had you during my husband whenever we were trying to get something approved. I wish, you know, there needs to be more of you. And I think Warris might have a resolution.
Do you want
Yeah.
to talk about this or not?
Yeah. On Wednesday, we'll be launching our AI-powered appeal service, Claimable. It's at www.getclaimable.com. And anyone with rheumatology conditions, UC, Crohn's, or migraine will be able to sign up and write an appeal and send it to our insurer. We're, with the work we've done, we've been beating insurance companies a lot, which is great, and getting people their care. An appeal costs $39.95 plus shipping, and you're quite likely to win. So, we've been testing this extensively. It's taken us probably about, time goes fast when you're building a
6
company.
months.
Well, it's taken
Well, 6 months of working with
6
me.
months of working with you, but probably about another year beyond that, and another 10 years of living in the US and working in healthcare to really try and understand the US healthcare system, which is bewildering.
You worked for the dark side, right?
I did, yeah, but it's, we'll back into that, but like it's bewildering to me. I remember moving here in 2014 and having American insurance and needing my inhaler. I'm asthmatic, and in fact, wait.
You got it, Anya?
Oh yeah, but look, these things are so expensive. I have to air tag it, so I know where it is because I always lose it around the house. And then my wife has to help me find it, but she's now tired of me losing it, so she air tagged it, which I'm going to say is very smart because replacing these things is about $400. So learning that my insurance didn't cover medications and that there was this thing called a PBM. I was completely confused, and so I spent a lot of time working in, building medical devices like MRI scanners and CT scanners and that kind of thing with GE. I then worked at Apple for a while working on consumer health, and then went to work at an insurance company because I wanted to understand how this all worked. I wanted to go to the purse for American healthcare and understand how things were paid for, and also launch programs that, funnily enough, help asthmatics. So I actually worked on a big program for asthmatics, kept a lot of them out of hospital inside of a year, tried to get Anthem to scale it. There wasn't much understanding that helping people in the Medicaid population was useful or helpful. So in the end, I ended up leaving because it was quite clear that one of these things wasn't like the other. I wasn't suited for a life in insurance, but on my way out, I got very curious about claims, denials, appeals, and I just realized how disconnected this whole system was and how there wasn't a good process for adjudicating appeals. And that idea kind of stuck with me. I spent the next 2 years at Amazon, who incidentally also don't understand healthcare particularly well. And their idea of healthcare is one medical, which is substandard for reasons. But in the end, I just wanted to do my own thing, and I wanted to get back closer to patients and get back closer to my days as a medical doc, working with individual patients. And so I started working on dissecting the data around denials, and none of it made any sense, because if you look at the numbers, there's something like 3 billion to 8 billion claims a year, right? The median number is about 5 billion. So that's the average, the average most common number of claims a year in the entire US healthcare system. And about 850 million, 17% are denied. So if you think about that, what does that mean? And this is where it started blowing my mind. So each human in America, so let's say let's make the maths easy, and say there are 300 million insured adults in America, might see their doctor 3 times a year. And each of those visits is associated with maybe 3 claims. That's a clinic visit, a lab, and a medication, right? That's 3 claims. So then if you think about that, you're at, 85 to 90 million Americans who are being denied every year. And only 1 million appeals to 2 million appeals are filed. So then there's, there's basically, 85 million Americans, give or take, who are going without care every year.
85 million with an M, okay? So I can listen to Warris and his accent all day long, but I want to just kind of dumb it down for a minute.
Sure.
So that the 3rd grader can understand it, okay? So here's the dealio, all right? I met Warris on Twitter 6 months ago, and we got to know each other. Thank you to Cigna. So I want to thank David Cordani and his shitty team over there, because I canceled our Cigna contract in August of 2023, and I have been trashing them since then. And Warris does patient appeals. His company does patient appeals. And Warris has essentially built an AI version of me. Okay? So you can have me help you with your appeal through him. So this is the trifecta of goodness going up against the trifecta of hell, and I'm looking at Express Scripts, OptumRx, and CVS Caremark. That's what we're doing.
Yeah, and I'll say that the appeals basically take... One thing I realized working in insurance is that the insurance companies have no idea who... They call you all members, they call us all members, but they have no idea who any of these people are. All of the photography, marketing, etc., are of really, really healthy people, spring out of bed and say thank God I have, Cigna, Anthem, Aetna, whatever, insurance. But they never speak to people. There's no mechanism for it. But we want them to hear patients loud and clear so they understand the impact of these denials, because it gets much, much, much harder to deny someone if they understand the impact, not having access to basic medications has on, their family, not being able to go to work, not being able to drive, not being able to play with their kids, not being able to put food on their table. These are very, very real things. And coming to Missouri and spending time in Bridgeton at the clinic, you see it every day. And it's not abstract, it's terribly specific when you meet these patients and you see that they're suffering, and you see that the harm that's been done to them, it isn't short term. Some of it is permanent. It's long standing. Even if they get back on therapy, they're never going to be quite the same. 2 weeks ago, we're not offering oncology services yet, but someone reached out to me with an oncology denial, and I spent about 2 months just trying to work on this because it was complicated and I'm not an oncologist, so I really had to get my head around it. But the patient had been denied medication for 9 months. They had their cancer therapy held up by 9 months. We beat that appeal in 1 day after submitting, 1 day. And I will tell you that it's going to take 2 years to get that patient back on track to where they should have been, and some of the damage is permanent.
If they survive.
If they
survive.
Yeah.
It's... these insurance companies, and I get that you're saying that people, the Anthem and the Cigna and all of the bad players, the insurance companies think that they're portraying people springing out of bed and saying, thank God I'm a member and I get my silver sneakers. No, these people are not saying that anymore. We're literally teetering on a collapse in healthcare right now, and I couldn't be happier to be a part of it.
Yeah, the thing is that a lot of the people who work in insurance, they believe they're doing God's work. They actually have no idea, because a lot of the marketing is actually targeted internally, like the training videos and everything. It features case managers helping patients out of jams. which, by the way, are mostly jams which are insurance created.
Oh, yeah.
But you know, you hear the call of the patient with really, really complicated care, and the case manager that gets on the phone and helps someone. This occasionally does happen where like someone is at a loose end and the insurer helps them, but it's like the minority case. The majority case is actually.
I have talked to less than 3 case managers in my 9 years of doing this. Those people don't know what they're doing.
They're managing.
The only thing that they're doing is they're in the United States of America, as opposed to being in India, going what, you know.
But
so
I guess.
But I have never run across anybody in insurance that thinks they're doing the right thing.
I think there are people there who believe they are, because the marketing works. It works internally.
Okay.
Like it attracts people who, because they have no contact with the real world, right? So like it's a closed loop system. They have no idea.
But they go out of their way to be uncontactable by me, by you, by the patients.
They don't care. Like some of the people who design, I don't know, like you have to think in a way it's purposely designed, but there are people deep in that system who truly, truly, truly have no idea what they're doing, and they don't ask themselves, you know, what is the actual societal impact of what's happening. Maybe it selects for people to stay there a long time with an absolute lack of critical thinking. That might be another way of thinking about it. Like the people who survive it for a long period of time never ask themselves the question.
Yeah. Right.
Could be that.
Am I doing good or am I doing harm? I mean, I don't need to, I don't have to meet with myself too often to ask that question, but I can tell you that I have some deep and high level contacts at every insurance company, only because I'm a complete bitch and I will not let go. And it's really hard, I saw that slide, it's really hard to beat someone who will never give up, and that's me.
Yeah.
And that's also you.
Who won't back down?
Who won't back down.
Well, the other thing about, you know, this goes for like giant health systems, this goes for insurance, this goes for like a lot of things like private equity, whatever. There's a quote from a famous American novelist, Upton Sinclair, who wrote Oil, which is the basis of the movie There Will Be Blood, which is one of the best films about the formation of California ever. And the quote says, "It is impossible to teach a man something if his salary depends on not understanding it." And that is extremely, you know, it's the case within a lot of American healthcare. Like you try and explain this to people. I've spoken to people in insurance and said like, hey, do you know what the denial rate is within your system? They're like, we deny 4% of cases. I'm like, manifestly not true. Like manifestly absolutely not true. Mm-hmm. And then they say, well, you know, when we're appealed, we overturn 97% of cases. And I'm like, excellent, great.
So all we need to do is get the patient to appeal, and boom, we're going to have some access to healthcare.
I mean, I think so. It's going to cause some problems for the insurers, but like the goal is really to get them to modernize. Maybe insurance never goes away. I'm from England, and so everyone, you know, the criticism might be that I'm looking for socialized healthcare, which a lot of Americans will never accept. And we can talk about that. But if at a minimum, the insurers followed their own policies, if they knew what their own policies were and their policies were up to date,
they're not. Then
you would have 65% probably fewer denials. I'm making that number up, but I'm thinking like, you know, about 2/3 of the cases we've seen are insurers either not knowing their own policies or not following them.
They're all too busy talking about how high is high and going on retreats and, you know, doing trust exercises with each other, and they're completely out of touch. So this is how we do things in St. Louis, Missouri. We sit on the floor in my foyer while he just ran 6 miles, sweating, and that's how we talk about stuff because it's relatable. So my message, we've got some great things going on today. Warris is here. He flew in last night, had dinner with my family. My message is go on this website, Get Claimable. So I'm saying get, G as in goat, E-T as in Tom, claimable, C as in cat, LAIMABLE.com. And sign up for early access, because if you want a Julie Bach working in your corner, Warris has got it.
And tell us what conditions, like if there are things we don't support yet, we're super interested to know what we should add next.
Yeah.
And so, we want to learn as people tell us what they need help with. And look, I'll be honest, there are going to be some things, like complex hospitalization cases, which are going to be too complicated for us to solve today in an automated way. But I will say that we want to close that gap. So we want to start with medications, move into investigations and tests, which is often a barrier to people getting diagnosed and then getting on therapy anyway. And then we want to think about things which are more complicated than that. And we've done really complicated things, but it's like
It takes a shit ton of work.
it's like all my time. It's like all my time forever. And
But the fact that you can do complicated things, we do hard things, and even though it wasn't in his wheelhouse, his company's wheelhouse, to do a really, really complex case, he spent 100 hours on it. And I tell people, I used to spend 100 hours getting one case. 100 hours is the magic number. Nobody in their right mind is going to spend 100 hours doing anything except me and you.
Yeah, well...
And not get paid.
Yeah, it's...
we don't get paid.
No, it's been some very creative accounting.
Yeah, so this Warris is a humanitarian, and I love a humanitarian, and he's literally doing the right thing, and this is going to be game-changing for patients in the United States of America.
I really hope so. Talking about socialized medicine just for a second. So I was a doctor in the NHS. I never...
NHS is National Health System?
National Health Service,
okay.
Yeah. So everything at the point of care is free. So you as a patient go to your primary care doc. It's like a giant organized HMO. So you go to your primary care doctor who refers you into a hospital specialist if you need it, but most of the care is kept in the community because it's lower cost. The NHS has been sequentially broken over the last
20
years, 25 years, by different governments trying to privatize it. By the way, Optum UK, who have advised on a lot of the changes in the NHS. It's completely crazy. But it's being intentionally broken to the point where I hear very, very smart friends saying anything would be better than the NHS. Mm-hmm. Just give us access to doctors and give us insurance. But they have no idea about the chaos that would wreak.
Well, my fear is if we had socialized medicine, it's not a fear. I know that this would happen. If we had socialized medicine in the United States of America, it would be United Health Cartel.
Yeah, it'd be Optum. It'd be Optum. That's the problem, because the way, even with Obamacare, the Affordable Care Act, look, the only good thing, there are good things in the ACA, which include the patient protections, the patient charter, the patient's right to appeal. All of those things are fantastic. Elimination of pre-existing conditions, all fantastic. The exchange, it's kind of a disaster.
Total disaster. So when he says ACA, he's talking about the Affordable Care Act. And so, what we don't want the good things to go away. We want the bad things to go away. But the only way to get the bad things to go away is make these insurance companies and PBMs accountable.
Yeah.
And if you're going to show up and I have a contractual relationship with the patient, I'm a patient and my insurance company, which happens to be Anthem, then you know what? You need to do right by them.
Well, they have to listen to you. And the other thing that we do with these appeals is, you've got the opportunity to send them to people. So writing the appeal is one part, but the distribution model of where they go becomes particularly important. So if they go... they might go to certain executives at the health insurer, which makes it harder to
say we didn't get it.
We didn't get it. They might go to your state governor.
Yes.
We've seen numerous governor investigations. It might go to the attorney general. I've seen J.B. Pritzker in Chicago or in Illinois, has certainly opened some investigations into certain insurance practices, which has been interesting to see. I've seen this happen in Colorado. I think this is about to happen in North Carolina. It gets really, really interesting.
Well, I'm all about having a plan A, B, C, D, E, F, and that B, C, D, E, F plans are copying the world, because after all, social media is the new prior authorization, and these insurance companies have no intention of talking to me or him or you, even though you're a patient, but they do not want to be publicly shamed. So if they don't want that, that's where I'm going.
Yeah. Let's hit it. So go to getclaimable.com, sign up for early access. We hope we can help you.
I know that he can help you. So this is kind of the first time we've really talked about that. And
Yeah.
I love that he's dripping in sweat and I'm not, because this is how real life is done. So he's going to get in the shower, and we've got some really cool meetings to do today.
Yeah.
And Claudia's here to take the dog because we don't want to have her
right.
barking. So fiddlesticks.
Right. Nice to see you.
Hi guys, sorry.
I got 30 minutes till
Okay.
Forbes.
Oh my God.
Come on, Bunny.
Yeah. Oh my God. Okay.
Man, I am. Who knew that standing up is a stunt? So.
So, Buns.
When you're done with those clothes, you can throw them in my washer, because that's my Super Bowl. How'd we do? Are we still on?
Yeah.
Oh. Okay, here, I'll do this.
Thanks.
That kind of stuff is gonna go a long way, Warris. We're gonna look back at this in 6 months and go, I can't believe we sat in your foyer and did that. It's so relatable though. Are you still on, Claudia?
Yeah, let me get off.
Yeah.
I mean,